FABM effectiveness in postponing pregnancy. Let's now take a look at fertility awareness-based method effectiveness rates. Here is a table with all of the level 1 or 2 studies of FABMs for postponing pregnancy, showing unintended pregnancy rates with both correct use and typical use. With correct use, the unintended pregnancy rate is less than 5 per 100 women years for all methods, and at or below 1 for the Billings, Creighton, and symptothermal methods. These unintended pregnancy rates compare well with artificial methods of birth control. Notice that there is no typical use rate reported with the Creighton model. This shows an extra complexity with FABMs. One of these Creighton model studies does not report typical use unintended pregnancy rates, while the other reports the total pregnancy rate. Total pregnancy rate also includes couples who are using the method to achieve pregnancy. This indicates that more research is needed that looks at pregnancy rates based on a couple's intentions in order to determine typical unintended pregnancy rates. Percent of women with pregnancy in the first year. This table shows the percent of women with a pregnancy in the first year of use of a family planning method. This data may look familiar as it is commonly cited in women's health and contraceptive textbooks. In viewing this data, let's pay attention to a few points. The estimates of the probability of pregnancy during the first year of typical use for fertility awareness-based methods, the male condom, the oral contraceptive pill, and Depo-Provera are taken from the 1995 and 2002 National Survey of Family Growth, corrected for underreporting of abortion. Essentially, these retrospective surveys asked women to recall which family planning method they were using at the time of conception. Interestingly, the only typical use effectiveness rate reported for FABMs is a combined unintended pregnancy rate of 24%. This is significantly higher than in the previous table. So which is the most accurate? Let's look at where these numbers come from. As previously discussed, the oft-quoted 24% unintended pregnancy rate is derived from retrospective surveys based on patient recall. Data for all FABMs are pooled, then adjusted to account for underreporting of abortion, and an estimated unintended pregnancy rate is generated. Furthermore, fully 86% of FABM users surveyed reported using a calendar or rhythm method, a much older method, as their primary form of family planning. This lumping together of data from retrospective surveys for all FABMs, including outdated methods, masks important differences in their effectiveness, a fact acknowledged by the author of this table estimate. On the other hand, the effectiveness rates from the previous slide are all based on prospective cohort studies. Clearly, prospective cohort studies of individual methods will produce more reliable data than a retrospective recall survey in which data for different methods is pooled. When we look at the high-quality studies evaluating the effectiveness for FABMs, we note these methods are much more effective than what is commonly reported. Also, when we look at effectiveness rates for artificial birth control methods that require behavior modification, for example, taking a pill, we see that these may be comparable to natural methods, which also require a couple to modify their behavior.